Hi everybody, this is Erica Bennett with South Georgia Medical Center. I'm here today with our Chief Medical Officer, Dr. Brian Dawson. We have been receiving a lot of questions from the community regarding the Omicron variant of COVID-19 and just in general what we're seeing throughout our community in South Georgia. So we wanted to take a moment to give you the latest information and then also equip you with tools to help keep you safe as we come into the Christmas holidays. So Dr. Dawson.
Yes, nice to see you.
Good to see you too. What are we seeing in the hospital?
So what we've seen is over about the course of the past 9 or 10 days, we were down at one point only having 3 cases in the hospital total, which nobody on the ventilator at that time. But now here recently, we've seen an increase to the point that we're up to 9 cases. Now, that certainly isn't as bad as back on August of 22nd of this year, where we had 112 cases. But it's a concerning trend, especially as we know that the Omicron variant is making its way throughout the Midwest, and certainly we're starting to hear of some cases coming closer to the Southeast, and this is superimposed on the Delta variant. And this year we're having an uptick in the number of influenza cases from what we usually do, specifically influenza type A.
In regards to COVID-19 vaccinations, that's another hot topic, and especially with the Omicron and the different variants that are coming out. What is the recommendation for getting your vaccine?
So we know that the Omicron variant appears to have some resistance to the vaccine, particularly with the first 2 doses of the Moderna or the Pfizer vaccines. But with a 3rd booster dose, it appears that there is increased efficacy back to what it was before with the Delta variant and the original Alpha variant. So we're strongly recommending for those who have not received their booster doses that they go ahead and receive their booster doses, provided that they're within the time frame of 6 months or more.
And to receive a booster, you have to be 16 and older?
To get the booster at 16 and older, as for now, unless things change with the emergency use authorization.
Okay. And we are continuing to give COVID-19 vaccinations at our Smith Northview campus, and we also have the pediatric doses available as well for anyone 5 to 11. So we do want to encourage anyone to go ahead and schedule that appointment or just walk in during the times of their operation, which is Monday through Friday, and go ahead and get that vaccine or get your booster shot if you're eligible. Additionally, we also offer testing at the Smith Northview campus and the walk-in lab here at the main campus. So should you feel sick with the rise of flu and other respiratory things going around, certainly seek medical advice from your primary care provider or one of our urgent care centers.
So I think it's important to also mention that tomorrow is officially the 1-year anniversary of when we gave our very first vaccine on December 21st of last year. And I think it's fair for us to acknowledge that the vaccine thus far has been our most effective weapon in being able to combat this virus. And so that's why we strongly recommend that those who have not been vaccinated, that they become vaccinated, because in our more recent surge we had back in August, I can tell you that the patients that were in the hospital, by and large, the very highest percentage of them were patients who were not vaccinated, particularly those that ended up in the ICU, and a very large percentage of those who had actually passed away from this disease. So we strongly recommend that during this holiday season that you make that decision, not just for yourself, but for your loved ones. I think it's important that we all protect ourselves.
Thank you, Dr. Dawson. And what a year it has been. I can't believe it's already been the 1-year anniversary, but we do want to thank the community for everything that they have been doing to support us throughout this time. And we just want everyone to continue to stay vigilant as it is ever changing with these different variants, and we just want everyone to be safe. So we'll remind you to wash your hands, watch your distance, and wear your mask when you're in large areas, specifically indoors. But thank you, Dr. Dawson, for joining us today.
Yes, ma'am. Thank you.
And we'd like to wish everyone a very Merry Christmas and Happy Holiday season.
Merry Christmas.